One of the more common prescriptions people receive for insomnia is Ambien. Let me tell you why. Historically, we used to use benzodiazepine hypnotics that had withdrawal problems, addiction problems, and quite frankly, had a shotgun approach, affected the entire brain. What's great about Ambien is it's a more narrow approach, doesn't appear to have as high addiction potential, and can be used in smaller dosages for shorter periods of time.
So let's talk about Ambien. Dr. Anokwute here, sleep medicine physician. Now, Ambien is one of the most common medications that primary care providers would prescribe, right? Because these are the providers that will first see a patient for insomnia before they come to sleep specialists like us. Now, this is a non-benzo medication, right? We know there are so many dangers with benzo medications, and so no longer being used as much. But the Z group, which is like where you have your zolpidem, which is Ambien, you have your Xalapon, you have your azopiclone. These are the three in that group. Now, these medications, even though they're commonly prescribed, does not mean that they do not come with side effects. They have very serious side effects, okay? Now, people could have side effects ranging from acting out in their dreams. We're talking about sleepwalking. We're talking about sleep eating. We're talking about, doing all sorts of crazy stuff in their dreams. And the most important thing, of course, you're sleeping, you have no memory of this, right? You wake up in the morning, and if you're sleeping with someone, the person's like, hey, do you know what you were doing at night? And you're like, no, I have no idea. Because one, you were sleeping, two, it causes amnesia. So you don't remember it, So very commonly prescribed, but not great medications, especially when you're using it long term. And so if you're using any of these medications, you want to start thinking, how can I come off these medications? Who can I work with to provide first line for insomnia treatment, which is CBT-I, and that stands for cognitive behavioral therapy for insomnia. All right, I'll see you guys in my next video.